Diversity is so important for nursing because when we think about the communities that we serve, to be able to reflect that community, connect with them when it comes to culture and understanding language, we have to have a workforce that mirrors that community. So it is important that we all support an increase in diversity of our workforce.
For Native people, diversity is important because, again, we don't live in a silo. Even though we have reservations, there's no fence up. And for Native American, of course, we still have the older generation. And so for them, we need to advocate for them too, that we continue to have the strong language, the language is still strong, that we're able to speak, and that we speak in the language that they understand, remembering that they are traditional people.
I really believe that nursing diversity is important. It's essential for us as nurses and clinicians to be able to ensure cultural competency so we can best serve our community, which is a very diverse community in New Mexico.
New Mexico is a very diverse state, and a lot of people move to this state because of the diversity. They like the culture. We are officially a bilingual state.
Diversity for the Native American people takes special effort and special care so that we can take care of them in a compassionate manner, with respect, and actually should go for all people.
In terms of men in nursing, we've grown in the last 5 to 10 years from about 5 or 6% of the nursing population to, I believe, between 9 and 10%. So males are more represented within the profession, and I think it is an important voice for the profession.
Something that nurses might see when we don't have a diversity in our workforce is there's a lack of understanding of where that person comes from in terms of culture. Not just language, understanding their language, but understanding their cultural practices, their cultural priorities, and ways to embed those things as part of the care. So it is important that we do meet those needs for our community. I've always been a member of professional organizations, and there are several that I'm very passionate about, but being a member and contributing to our own profession is key for nurses to be able to leave a legacy that will last a lifetime. I mean, when we think about our future generations and those that are going to come after us, we have to leave in place a strong, supportive network from within.
Hi, my name is Bema Tamang, and I am from Kathmandu, Nepal, and I've been a nurse for only about a year, not even a year. Actually, I graduated in December, got my license in February 2014, so I'm a fairly new nurse.
I believe professional organizations are incredibly important, and the New Mexico Nurses Association is vital to our protection as nurses. When I was younger, I thought that the Board of Nursing protected nurses, but they protect the people, which is really important also.
The ability to spend time with nurses who have similar interests and nurses who are willing to work together and collaborate, because we get caught up often in our own individual practice, in our job, in the sort of the soap operas of our workplaces, in the facilities where we're employed. And it's important often to get together and talk about our practice itself and how our practice is going and how our career is developing. And it takes us out of that very pigeonholed place of our workplace and lets us talk in the broader context of an organization or association.
New Mexico was able to participate in the early 80s and 90s as a New Mexico chapter of Hispanic nurses. And at that time, we had a membership of approximately 40 nurses throughout New Mexico. It was very challenging to be able to keep up our membership throughout the years. It's really important for us to be able to partner with NMNA so that we can all take part in developing a diverse nursing community throughout New Mexico.